Hello, my dear students. How are you all? I hope all of you are amazing. So, I'm Rashmi Mamgai, Zoology Master Teacher. Welcome you here at the Triumph Ultimate Recap. So, we have done this chapter, reproductive health, already in the class in detailed way, and I'm just going to recap this chapter for you all. And I'm sure that all of you are so much excited. So, let's start our session. Let's see the recap, or let's see the summary of the whole chapter, right? So that you can revise it nicely. So let's see the summary of the full chapter. And this is the reproductive health. So what is the reproductive health? We know according to WHO, reproductive health means a person is physically, emotionally, behaviorally, social well-being aspect and overall aspect of reproduction, right? So well-being in physical, emotional, behavioral and social aspect of reproduction. And we will see reproductive health in this chapter. We will see its problem, we will see the strategies to solve those problems. So when we talk about the reproductive health, how to maintain the proper reproductive health, what are the strategies? So yes, you have to remember that planning program or reproductive health care. So this is the strategy of the reproductive health, right? So this planning or reproductive child health care program was first initiated by our country in 1951. So in 1951, first initiated by India, you have to remember. And what was the purpose of this program? Also popularly, this family planning program, popularly known as reproductive, popularly known as reproductive child health care, program, right? So the main focus was on the main focus to build up the reproductively healthy society was to make people aware, to create the awareness among them about the reproductive health, and second, to support or give them facility to actually improve their reproductive health, right? So that was the purpose of the family planning program or reproductive child healthcare program. So what exactly happening in the country? So we know that our population is increasing a lot, right? So population explosion is there, and which is affecting various aspects of life, we know. So when there is huge population, what will happen? There will be unemployment, there will be more poverty, there will be lack of facilities, right? So these are the problems related population explosion, and Indian growth rate is already 1.7%. So which is already very high, right? So this 1.7%, although look very different, very small, but actually this is very huge amount because already Indian population so high, right? So what are the reason behind the population explosion? Decrease because reproductive health is improving. They are getting good health facility. They are getting good medical facility. Because of that, decrease in infant mortality rate. So what is infant mortality rate? Means now infants are dying. I mean their death rate is in decrease, right? So infant means newly born. Mortality rate is low. Maternal mortality rate, because now we are getting the good medical facility. So yeah, maternal mortality rate is also down. That's why population is increasing. Improved healthcare system, better living conditions. So that's why these are the reasons for the population explosion, right? So we have to control it. So our government has to, I mean, they have to make such policy because our population is increasing. It will create a lot of problems. So we have to tackle it. We have to control our population. So how can we do that? We are having contraceptives that we will, right? So when we see the contraceptive methods, birth control method, so obviously it's the method or device which prevent conception but allows sexual intercourse. Yeah. So it is birth control, right? This is the birth control. So birth control method or contraceptive conception method. What is this? The method or device which will prevent conception or pregnancy, right? But allow sexual intercourse means without interfering in the reproductive health or in the reproductive organ, it will prevent pregnancy. All the devices that will prevent pregnancy. So, first, ideal contraceptives are use of So first contraceptive pills, what are the, ideal contraceptive pill? What are the characteristics of ideal contraceptives devices? So they should be user friendly, means easy to use, right? They should be easy to use. They should be cheaply available for the for all the population, right? Easily available, least or no side effect. There should be no side effect of any devices that people are using, right? Reversible means it should not change, reproductive organs, or it should not brought any changes in the reproductive organs. So we have to see that it should not have any side effect in the body, and it should be reversible, right? So there should not be any permanent change in the reproductive organs. Sexual desire should not be affected, means these are the ideal character of contraceptive devices, right? So you have to remember it. Next, we have to see first contraception. So we have to see the types of contraception: barrier method, sterilization method, natural method, hormonal method, intrauterine devices. And intrauterine devices is widely used method in our country. So it is widely used method, contraceptive method by Indians, because it will basically, it remain effective for the longer duration, right? So suppose some people want to create space between the children, so what they will do, or gap between the children, they will just go for the IUDs, right? So let's discuss all the type of the contraception one by one, right? So let's start with the natural method first. So natural method, so all these are contraceptive method, right? So out of this, barrier method, hormonal method, IUD, natural method, these are temporary method. Temporary means obviously changes can happen, right? So this is for the temporary time, temporary method. Whereas if we talk about sterilization, vasectomy, or tuberculotomy, these are the permanent method. Why permanent? Because they change permanently, right? They bring changes permanently. So this is done by those people who don't want to conceive again in life, right? So they are done with their babies and now they don't want to conceive in the life. They want permanent cessation of pregnancy. So those people will actually adopt the sterilization method. So let me take you ahead and let's discuss all the types of contraception in detail. So first contraceptive method to prevent pregnancy is natural method. As the name suggests, we are not using any device here, right? So no, we are not using any devices here. No contraceptive devices or pills are used. No contraceptive devices are used here. So how exactly a natural method will work? We will see. So you tell me how it will work. Yes, exactly. It will work in, it will basically, it based on the principle. It is based on the principle of reducing or decreasing chance of sperm and ovum meeting. So means sperm and ovum meeting chances are decreasing, right? So that is basically natural method. So when we talk about the types of natural method, one is the lactational amenorrhea. So this is basically happen after parturition. What happened after parturition? You all know that just after baby delivery, what happened? Mother is in the intense lactation. Intense lactation means, feeding the baby, right? Lactation means milking. So intense lactation phase, and this basically, and at this particular, at the time of the intense lactation, what happened? This female is not able to conceive, right? Why she's not able to conceive? Intense lactation phase. At this time, this is the phase of lactation, intense lactation phase, and at this time, prolactin hormone is huge in amount in the body, right? So prolactin hormone is huge in body, and it will stop the secretion of, it will prevent secretion of other hormones like FSH, LH, right? And we know these are important for the follicle formation and ovulation. So when these hormones are decreased in the body of the female, no ovulation will happen. while the female is at this particular intense lactation, right? So after parturition, and this is effective up to 6 months of pregnancy, effective up to 6 months of pregnancy, got it? Up to 6 months of, after parturition. So it will be remain effective after parturition, effective up to 6 months. Female cannot conceive at this time because I have told you reason. Second is the withdrawal or coitus interruptus, in which penis is withdrawal or withdraw from the vagina before ejaculation. But the chances of the failure, the chances of the failure is very high here, because pre ejaculation semen can be released, premature pre ejaculation semen can be released in the vagina. So obviously here the failure chances are more. And as I have told you that failure chances are more in this condition, but yeah, can be prevented, right? So pregnancy can be prevented by this method, but again, failure chances are more. Periodic abstinence or no mating between 10 to 17 days, we also called it rhythm method, we also called it safe method, we also called it calendrical method. Why so? Because we have seen in the reproductive health chapter in detailed way and in the short summary form that in the menstrual phase 10 to 14 days, or basically 10 to 17 days, are considered highly fertile period. So at that time, because at that time there's the high chances of ovulation, right? So that time is considered risky period, so one should avoid any sexual activity at the day of 10 to 17 during the menstrual, right? So during the whole menstrual cycle, so periodic abstinence means no mating between this day, because these days considered the fertile day, as the chance of ovulation are more at this particular time, right? So these are the natural method in which we are just decreasing the, we are just decreasing the chance of the sperm and ovum meeting, right? And this is how pregnancy can be inhibited. So next is barrier method. As the name suggests, barrier means it is covering the reproductive organs, so that it will prevent the sperm and the ovum meeting, right? So what is the principle behind it? It will prevent sperm and ovum meeting. It will prevent contact of sperm and ovum, right? Prevent sperm and ovum contact. So best example, condoms. So it is made up of rubber or latex. Disposable. It is for both male and the female, right? So male condoms are available. Female condoms are available, known as femidomes. So when we talk about the condoms, they are preventing STDs also. Neat question. They are able to prevent sexually transmitted disease, so they are preventing this also, and plus acting as barrier, basically reducing the chance of sperm and the ovum meeting, right? So diaphragm, cervical caps in this. So diaphragm look like this way, right? Cervical caps are nipple like structure, bolts are the small miniature diaphragm. So when we talk about this, they are lining the, they are basically covering the, lining the cervix or vagina, to prevent this sperm entry in the female reproductive system, right? So it will cover the cervix region and vaginal region to prevent the entry of the sperm in the, right? But they cannot prevent STD, cannot prevent STD. Even they are reusable also, as it's written over here. Disposable, and the people can use it again, right? So these are reusable also. So these are the barrier method. Next, when we talk about IUDs, intrauterine devices, means these IUDs are basically inserted inside the uterus, right? And this is basically done by the expert. So the user cannot use it personally, right? So they have to consult the expert doctors or nurses to basically go for the IUDs, right? So they will just insert the IUDs in their body, in the uterus. So IUDs is basically insert in uterus by expert doctor or not. A person cannot use them without their supervision. So yeah, Next, what are the types of IUDs? And I have told you that Indian population generally go for this because this age of the IUDs are more. So a person who want to make the gap between the two kids, so obviously they can go for the IUDs, right? So it is having the non-medicated or inert IUDs. So how exactly they work? So they will be making the female reproductive tract so toxic for the sperm, right? And they will prevent sperm ascent. They will not allow the sperm to go to the this fallopian tube, right? They will do the phagocytosis of the sperm. This is how exactly inert IUDs work. And the best example is the lipis loop, right? So lipis loop is the best example of the inert IUD. When we talk about the hormone releasing IUD, so it is generally having the progesterone. So progesterone is the hormone which prevent ovulation, we know, right? So it prevent ovulation. It is the anti-ovulatory hormone that I have told you in the last class of reproductive chapter, right? So yeah, it will prevent ovulation and make the uterus unsuitable for implantation. Now you'll ask me, mom, in the human reproduction chapter, you said that progesterone is required for implantation and pregnancy. Here you are saying it make uterus unsuitable. How come? Because progesterone, if increase more than the optimum level that is required by the body, if it gets more than that, then it will definitely affect the body in negative way, right? So that's why it will affect the uterus in negative way. When its amount go up, then the requirement of the body, right? So progestasert LNG is levonorgestrel, right? So when we talk about LNG, it's levonorgestrel. This also having the progesterone hormone in it, and it will again prevent the ovulation and make the uterus unsuitable for implantation. Plus it will increase the mucus, cervical mucus. So the hormonal IUDs also increase cervical mucus, so that sperm will not able to enter the reproductive tract. So this is how exactly it works, right? Next is the copper releasing IUD, copper T, multilode 375. They will suppress the sperm motility, and hence it will, this condition, when when the sperm motility decreases, suppressed, it will not be able to fertilize the, right? So obviously it will decrease the ability of sperm to fertilize egg. So this is something, fertilize egg. So this is something which you have to remember about the copper releasing, because it releases copper ion, and this copper ion will suppress the sperm motility. So you have to remember which IUD actually work in what way, right? So it will prevent sperm ascent, or by phagocytosis of sperm, it will do this and it will do this. So you have to remember them individually for the NEET exam. Many questions they've asked from here. Next, hormonal methods. So single progesterone only. So some pills are there which is having only progesterone, right? So they are also known as single progesterone only, or we also called it to like having only the progesterone in it. And other one is the combination, right? So it is the progesterone only pill. We also called it POPs, progesterone only pills, and combination of progesterone and estrogen. So some pills have the combination of progesterone as well as estrogen. So both the hormones will actually inhibit ovulation, implantation. It will make the cervical mucus so thick to to prevent the entry of the sperm in the female reproductive tract, right? So this is how exactly the hormonal method pills actually work, right? And other pills are the non-hormonal, right? So some pills are non-hormonal pills. So what is the best example of non-steroidal or non-hormonal? Non-steroidal. So we called it non-steroidal pill. So the best example of non-steroidal pills are Saheli, which was developed in CDRI, Central Drug Research Institute, Lucknow, India. You have to remember. And they don't have any estrogen or progesterone, or they don't have any progesterone. They don't have any steroidal hormone. So you'll ask me, ma'am, that then what they have? They have centchroman. So centchroman is a particular chemical that will prevent, that will just block the estrogen receptor, right? Estrogen receptor on uterus. So means they contain scent chromen. And what is the purpose of scent chromen? They are the estrogen receptor modulator. R for receptor, estrogen receptor modulator. And when we talk about the non-hormonal or steroidal, non-steroidal pills, so they are basically taken once a week, right? So you have to remember about this. Now we are just going towards the sterilization. So when we talk about the sterilization, what happened in this condition? Sterilization means permanent method, right? So here we are just cutting the, in the male and the female, some part is cut and tied, and we are preventing the sperm or gamete transfer, right, in the female reproductive or male reproductive tract. So let's see the diagram. So in the vasectomy, right? So sterilization in the case of male sterilization, in the case of male sterilization means male is sterilized. Sterilization means now this male will not able to transfer the sperm, right? And tuberculotomy is female sterilization process. So what happened in both the process? Let's see. So in tuberculotomy and vasectomy, so when we see the vasectomy, vast difference is cut and tied. And here in female, fallopian tube is cut and tied. Why so? Because sperm formation happen here in the testes, and this sperm from the epididymis, vas deferens, will try to come out, but again this sperm will not able to come out, right? So the main purpose of sterilization to prevent the gamete transfer. And here if we are cutting the fallopian tube, sperm will not able to reach the reach the site of fertilization in the fallopian tube. That means in ampulla region they will not able to go there and fertilize the egg. So means what are our main purpose of sterilization? So it will prevent only transfer of gamete. So they will not allow transfer of gamete. They will not allow this gamete to transfer, right? So then you will say, ma'am, what will happen? I mean, it will affect the gametogenesis also? No. So gametogenesis is not affected in both the cases, right? So means if we talk about gametogenesis, that means formation of the sperm and egg will generally happen, right? It will be normal. Normal gametogenesis will be there. There will be normal menstrual cycle, right? Normal sexual activity, everything will be normal, everything is happening except this prevent only gamete transfer of the transfer of the gametes. So gametes will not transfer for fertilization. Only this is hampered, rest all the things will happen normally. Normal gametogenesis, normal menstrual cycle in female, normal follicle formation, normal egg formation, normal everything, but it will just prevent the transfer of gametes. It will be affected. This will only be affected, right? Normal sexual activity will be there. So next is the, so when we talk, so these are the, some other method, like if we talk about chemical methods, right? So we are having the chemical methods also, in which some foam, some jellies, and some, creams are applied in the female reproductive tract. So what exactly they do? They basically having the citric acid, they are having the lactic acid, they are having the boric acid, they are having the potassium, they are having the potassium permanganate, right? So means all these chemicals are basically the spermicidal. They are having the spermicidal effect, and it will kill the sperm. So chemical method along with the barrier method is used, right? So to make the to make this to prevent the pregnancy, to make the contraceptive method more effective, chemical method with barrier method is used, right? Barrier method, the chemical method, these foam jellies with the barrier methods are used to make contraceptives more effective. So it will prevent the fertility. It will make the contraceptive method more effective, right? So if a person use these two things together. So implants, other method is implants. Implants is basically placed subdermally, means below the skin, right? So obviously norplants is the example, implanons are the example. Implanons, they also have the good time period, right? So they also keep in the body for the, or remain in the body for the longer time. They remain effective for the longer time. So implanons are basically put beneath the skin, right? And then if we are using the big implanon, so in that case, little suture is required, as no suture is required, right? So and sometime when we are using these implants, we are having the silicone little sticks, a needle like silicone, silicone needles, right? So that is placed beneath the skin. So they will secrete the progesterone in the blood to prevent the ovulation, right? So oral contraceptive we have done, IUDs. So all these methods we have done. This is the summary of all the things that we have discussed, right? All the contraceptive. Next process is amniocentesis. Many times they ask question from this. So amniocentesis means, we know this is a placenta. So this is the placenta which is connecting the baby via this what we call umbilical cord. This is the amniotic, this is the amnion around the embryo, and the embryo, around the embryo we are having this fluid known as amniotic cavity. Amniotic cavity is there, and which is filled with the amniotic. So via syringe, we will just take out the amniotic fluid, which is basically present around the small, fetus. So we know what is the amniotic fluid, what is the what is the placenta. We have discussed it in the report. So yeah, you know very well that we will take out the, amniotic fluid. And amniotic fluid has the cell of the small fetus. So using this cell has nucleus, we will take out this, chromosome from it, and we will see if a person having some chromosomal disorder or genetic disorder in it or not, or if a person is fine, right? And some people misuse it to check the sex of a fetus, and then in some country, fetal fetus, right? Female fetus. So amniotic cells are taken, amniotic fluid is taken, which is having the cell of the fetus. So we can check the chromosomal and genetic disorder, and we can see if the proper chemicals are forming, proper proteins are being made or not. That is the purpose of using the amniotic fluid. Chromosomal genetic disorder, like we know we are having the Turner syndrome. We can just get to know about the Turner syndrome, or what else, or like Down syndrome, Klinefelter syndrome, right? So we can actually find out the genetic disorder in a person using this amniocentesis process. But again, some people misuse it, right? So some people misuse this process for the sex determination. So people some people misuse it, misuse it for determination of sex, determination of sex of fetus, and then they do female fetus. So once they get to know that this is the female fetus, so they just go for the feticide. They just go for the fetal killing, right? So they just kill that female fetus. So another method is the MTP, that is the abortion. This is the deliberate abortion, right? So people just go for abortion in various cases. So induced abortion means a person deliberately doing it. MTP Act was in 1971, which made the MTP legal under, with some restrictions, and it is allowed up to 20 weeks. So in 1971, they said that it is basically safe. You can go for MTP up to 12 weeks because this process is safe up to 12 weeks, right? But after that, it is so risky. So if you are just going for the 20 weeks because it's allowed in 2000, they have just, they have given the other amendment, right? So in which they actually talked about the about this, right? They have increased the time period that you can do the abortion up to 20 weeks, but under the supervision of two special doctors or two specialists, right? So obviously, a person can go for the abortion up to 20 weeks, but under the supervision of the two doctors, right? So safe in the first trimester, it is safe up to 12 weeks. You have to remember, NEET question. And MTP Act amended in 2012, basically, and up to 12 weeks, opinion of one doctor is needed. But if a person having more than 12 or up to 12 weeks, opinion of two doctor is needed, this is something which you have to remember, right? So this is about the MTP that you have to remember, right? So, I mean, they increased the time period up to 20 weeks in 2002, actually. 2002, it was, 2002, it was empty. So they have increased the time period up to 20 weeks in 2002. But before that, they were allowed to do the MTPs only up to 12 weeks because it's safe up to 12, right? So I have just written it that how many doctors is required for different, right? So this is about the MTPs, induced abortion. You have to remember. And next, we are just going to do the STDs. So STDs means sexually transmitted diseases. So if a person is basically involved in the sexual intercourse with a person who are having the diseases, they can also, I mean, this disease can also transmit who is involved in all, right? So disease which are transmitted sexually through sexual intercourse, also known as venereal disease or reproductively tract infection. So STD can be classified into viral, bacterial, protozoan, and fungal, etc. So you can see this whole diseases: chlamydia disease caused by bacteria, chlamydia trachomatis; gonorrhea bacterial caused by the Neisseria gonorrhea; syphilis also bacterial; chancroid also bacterial; herpes, warts, and AIDS are viral; hepatitis B viral, right? Trichomoniasis protozoal. So you have to protozoan. So you have to remember all the causative agents also. So when we talk about the herpes, when we talk about the AIDS, when we talk about hepatitis B, they don't have any cure. These STDs don't have any cure. So these are really dangerous. Only there is prevention, no cure for the diseases, right? Three diseases that I have mentioned. So next is infertility. Infertility is the problem of the reproductive health. Sometimes people are, involved in the mating or involved in the sexual intercourse, that where they are not using any contraceptive, but still they are not able to conceive, right? So inability to conceive or produce children even after 2 years of unprotected sexual intercourse. And reason can be physically their organs are not are not they are not formed enough mature, or they are having certain issues, or physically they are damaged. Some problems are there in their reproductive organs, so they are not able to reproduce. Congenital, there can be some genetic disorder can be their organ. Diseases, drugs, immunological, psychological. So any things can be responsible for people who are drinking more alcohol, or those people who are into drugs. They actually induce infertility right? Sometimes physically means they are not physically fit for for this activity, right? Or they have some issues in their reproductive organ, as I have told. They're having certain diseases, so that they are not able to reproduce, right? Sometimes the people who are having the condition of thyroid, so they are also not able to reproduce, right? So next is immunological. Their immunity is so much weak that they are not able to conceive anyway. And sometimes it's psychological also, right? So in case of male, what are the reason for infertility? Oligospermia means low sperm count. When sperm count is less than 20 million, right? So 20 million per ml or less are actually oligospermia, which cause infertility. Asthenospermia means low sperm count. Azoospermia means no sperm at all. Erection dysfunctioning, they are not able to inseminate. Stress and psychological reason, autoimmunity agent sperm. So sometime their autoimmunity start killing the sperms, right? And in that ways they are not able to reproduce, they remain infertile. So these are the reason of infertility in the male. So when we talk about the overcome the infertility, how can we overcome this infertility condition female? Or so let's see what are the reasons, or what are the technique we are having. Assisted reproductive technologies, art technique. These are the special technique to assist the people, assist the couple to have the children, right? So first technique is the in vitro fertilization or embryo transfer. So when we talk about the IVF technique, so we know very well in the IVF or in vitro fertilization or test tube. So in this fertilization happen outside body, right? So we are taking the sperm from the donor or the healthy, or a husband. So fertilization is outside, or we are taking the egg from the donor or the female wife. So in IVF, what exactly being done outside the body in the lab? We are just, providing them proper condition, same condition, body. We are providing all the medium that is required for fertilization. We are putting egg and sperms here, right? And now this sperm will fertilize the egg. After fertilization, embryo will be formed. So now embryo having 8 blastomere, or you can say embryo zygote, or embryo up to 8 blastomere, means 8 cells. If this is the condition in the test tube, we can put the zygote or embryo up to 8 cells can put in the fallopian tube. So we will put it in the fallopian tube because up to 8 blastomere, this condition is actually formed in the fallopian tube. So we have to put it in the fallopian tube known as ZIF. That is the zygote NEET question. Intra means inside, fallopian tube. So we are putting the zygote or embryo up to 8 cell stage in the zygote. Intrauterine in the fallopian tube, right? Intrauterine. Intra means inside. Uterine transfer when the embryo has more than 8 blastomere, right? So it is basically up to 8 or more than 8 blastomere means we will put it in the uterus, right? So obviously it is basically put in the uterus. So it is known as intrauterine, because we know that in uterus more than 8, when the embryo convert more than 8 blastomere stage, then it comes to uterus. So we have to put it in the uterus of the female who is going to conceive the, or who is going to develop the baby, right? Intrauterine transfer. Intrauterine transfer. So you have to remember these two things in the case of the IVF, that after fertilization we just put it in the female body for further development. So means for further development of the fetus happen inside the body. So that means it happens in vivo. In vivo means inside body, right? And fertilization is in vitro. In vitro means outside body. So development happen inside and fertilization happen outside. So next is the gift gamete intrafallopian transfer, means we are just taking the gamete. Suppose this is the egg. We have taken the egg from a female and just injecting it in the fallopian tube of other female. So why we are doing so? So suppose this female who is not able to produce the egg, but able to give the uterus for implantation, right? And rest all process will go normal, female body. And she want to conceive also. So in that case, we will take the egg from the donor and put it in the fallopian tube of this female, right? So means here egg is transferred in female who is not able to produce egg, but able to implant and develop baby inside her, right? Develop embryo inside her. So in that case, gamete intrafallopian transfer is done. You know ZIFT we have discussed, IUT we have discussed. ICSI is intracytoplasmic sperm injection. This is the, in this fertilization also happen outside the body. So here in case of gift, fertilization is in vivo. In vivo means inside the body. In vivo fertilization and development also. So fertilization happen inside the body and development also happen inside the body in case of gift. In case of ZIFT, in case of IUT, fertilization happen outside, but development happen inside, right? And same ICSI also, in vitro fertilization, right? So in vitro means outside the body. So in ICSI, single egg from the donor or the wife and sperm from the male is directly injected in the female body. So means single sperm. What is the difference between IVF and ICSI? In this, we are taking the single sperm or spermatozoon. We are just directly injecting its cytoplasm, directly fusing it with the egg. We are taking one sperm and directly injecting it in the female. So the success chance of this fertilization is more in comparison to other, technique, right? So in this, basically fertilization happening outside the body, sperm taken from, and this is basically done those male who are having the oligospermia condition, right? So it is done in case of oligospermia. So suppose those male who are not able to produce sufficient sperm, they actually go for the ICS. So in what is the difference between IVF? Here we just put many sperms in the test tube, but here we are just directly fusing sperm, single sperm with the egg. This is the difference, and they have asked this question in. So if they will ask you that a single spermatozoon directly injected in the egg, this process is known as ICS, right? Intra means inside the cytoplasm, sperm is injected. And then we are having the artificial insemination. What is the artificial insemination? We are taking this artificial insemination, we are taking the sperm from the male or from the donor and directly injecting it in the female reproductive, right? So obviously sperms are taken from husband or donor, right? Anyone, husband or donor. And then what we are doing, we are just basically injecting it in the female body, right? And injected artificially in female body, female reproductive tract, right? And this is basically done for the condition in the male oligospermia. So those male who are having oligospermia condition, artificial insemination is very effective for them, right? So artificially the sperm is taken out and artificially injected in the female body for the fertilization. And if the sperm directly injected in the uterus, that artificial insemination known as intrauterine insemination. Intrauterine means inside uterus. Insemination means semen is injected, right? So semen is injected in the female body, and obviously fertilization, right? So you have to remember all these steps. I hope everything is clear to everyone. That's all. We are done with the chapter summary. I hope you like it and see you all in the next class. So please revise everything nicely. See you all. Have a great day.